All right, welcome everybody to December 13th Youth Service Advisory Board meeting. We'll just go around and do, we'll call official call to order. So we do have a quorum, so we're going to get rocking and rolling. So we'll go around and do introductions. I know that we have some new folks here joining us today. So I'm Larry Barlow. This will be my, I'm the principal at Mansfield Middle School. This will be my last Youth Service Advisory Board meeting. I'm currently the vice chair, and I'll swing this over to Danielle, who will be taking over my role as rep for Mansfield Public Schools at the Youth Service Advisory Board.
Hi everyone, I'm Danielle Vliet. I'm the assistant principal at Mansfield Middle School.
And then if we can just go around and everyone else can just share who they are. We do have some other new faces.
I can go next, and then if you want, Larry, I can call on people because I know it'll be different on everyone's screens. My name is Katie Bell. My pronouns are she, her, hers. I'm the youth services supervisor here for the town of Mansfield. And then we'll bump over to Laura.
I'm Laura Wright. I'm a youth services community user of the services.
And Trooper Fillion.
I'm Trooper Fillion, Mansfield resident trooper on the community liaison and the school liaison for Mansfield.
And Deb.
I'm Deborah Hulkran. I'm a community member to the advisory board, and I'm also on the Board of Ed for Regional School District 19, the high school.
And Lisa.
Hi, Lisa Gerard. I am from Favor and I'm a family systems manager.
And Pat.
I'm Pat Schneider. I'm the Director of Human Services. This is technically my last month here at Youth Service Advisory. Unfortunately, they were not successful in hiring my successor. So I am going to be helping out through probably the budget time. So I'll be around a bit in January and February as well. So, but this would technically be my last meeting here.
And then Robin.
Hi, I'm Robin Kramer. I'm the new youth service social worker. I started last Monday, so we're on week 2 now.
Awesome. Welcome everyone. Thank you. As we jump in, I'd like to approve the minutes. So we are scheduled to approve. Let me just find I didn't print my agenda, but let me just pull that up. So we're looking to approve the September 13th, 2022 minutes.
So moved.
Seconded. Laura seconds.
Seconded.
Thank you, Laura. All those in favor of approving the minutes, say aye.
Aye.
Opposed?
Aye.
Opposed, say nay. All right, thank you. So we have approved our minutes for September 13th, 2022. We'll move over to reports. So we have our youth service report by Katie Bell.
All right, thank you. So I know it's been a while since we've met, since I believe we didn't have a quorum in October when Pat was covering for us, and then we didn't meet in November with all of the staffing and election days. So this is the first time that we've met since the September meeting. So the big updates are very much focused on staffing and program for the first half of the year. So we're really excited that Robin has joined us. It is going to be huge for us moving forward in keeping those programs running and rolling. Kelly and I did our best to cover the flagship stuff while we were very, very down, because not only did we lose Amani over the summer, who had come in to the position that Danielle Anna Bellini had been in for so long, we also had a transition from Sarah Dufresne leaving our early childhood services coordinator position and moving over to the human services adult services case manager position. So she moved over there in September. And so we've been kind of doing our best within the department to make sure everything gets covered, even if it's not the usual way that it is staffed and covered, but keeping those programs all afloat. So in terms of other staffing news and updates, we did just officially hear that we did have someone accept our other vacant position for the youth services social worker position that y'all as an advisory board had advocated to get added to our budget this year. So that individual, I believe, is scheduled to start in early January. So we'll be excited to have that individual joining our team. We are also in the recruitment process for the early childhood services coordinator position. That posting has closed and we're getting ready to kind of line up our panels and looking to get that position filled pretty quickly, particularly with the upcoming grant season for that position that's very heavily tied to the core duties. So Sarah Dufresne still being within our human services department is immensely helpful in getting that new person up trained, whoever they will end up being, just to know all the ins and outs of working with the Office of Early Childhood for the state of Connecticut and the School Readiness Grant and the Mansfield Advocates for Children Board. So we're excited that that is in process, in progress, but definitely kind of still a little bit in treading water and kind of taking that deep breath to get ready for the next thing, but we'll be in a much more robust staffing position for the new semester. For our interns this year, Sarah Dufresne is still our MSW intern at Youth Services. So she's been able to maintain some half days at Mansfield Middle School on Wednesdays, which has been helpful, certainly while we've been down the staffing, but also for that continuity of care of the cases that she'd been seeing since last year and supporting the coverage. So that has been a great linkage for our youth that are connected to Sarah, our families that are connected to Sarah, and keeping Sarah in that ability to support us with the MSW internship that she's doing. And then for our other intern, we do have a BSW student from Eastern Connecticut State University who has joined us for her first semester. So Sophia is being supervised by Kelly McKenney, and she's been helping to support one day of the mentoring program at the Cope Vinton site, as well as supporting the Wellington Ashford Mansfield Restorative Diversion team, and also carrying a small caseload. So she'll continue on with us next semester. Her hours are going to shift a little bit. So she is not going to be doing the mentoring. She is going to continue on with the X block or the 5th grade lunch group check-ins that she's been doing. Robin's going to cover those in Sophia's absence on the Thursdays. So those kids that we've linked into those programs will still have a familiar space and a face that has been introduced, which is good because I know we've got a couple kids that we're working really hard to keep linked in those services this year. So that is ready to kind of transition in and then kind of transition back to Sophia when she's back. She is going to be on Mondays next semester supporting some programming over at the senior center. So she'll not just get the youth services experience, but she'll also be able to support some human services programming as well, to have a little bit more broad of an age range in her internship program. Counseling services. Now that Robin has joined us, we have some openings coming up for those outpatient hours, as well as more spaces for youth to be seen at the middle school on Thursdays. So I know Robin, I think, has already got like 3 referrals in the week that she's been here, because that is how referrals work. As soon as we have humans that are eager to connect, and we're happy to do those connections. So those counseling services have continued. We've had to do a lot more referrals in the past few months to outpatient services just because of staffing availability. But we've all been able to kind of help make sure that those families are able to connect to local providers in the area, whether it's CHR, United Services, or Perceptions have been the big ones that we've referred to just because they tend to have the quickest turnaround and most wide range of availability for scheduling, which we find most families are able to make work as long as they've got insurance coverage, and we haven't run into anybody who's kind of needed that extra support around insurance. So we've been able to kind of keep the referrals connected to services, but we do have a little bit more availability coming up, particularly in January when families start becoming more available. I know a lot of the referrals we get right now, everyone's kind of like, well, we'll wait till after the holidays, which is certainly understandable this time of year. Our mentoring programs were busy and they were big. this year. Our Big Friends program was a little bit smaller than it has been in years past, and we had to make some adjustments along the way. But it was great to be able to still keep those kids connected. We got, some newer kiddos that we were not connected to before that might be new to district. And the middle school did an amazing job in kind of helping us kind of see what resources we needed to meet the needs of those students. So we were able to get some extra paraeducator support in the after school hours for students who normally have that paraeducator support during the day, so that they were able to more successfully participate in program, which is really great because we're kind of just looking at what are the current evolving needs and how do we meet them all for everybody. And that partnership being really collaborative was really just a great time, and the kids really enjoyed themselves. One of the things that we did kind of recognize in this only being the second time that we've done the Big Friends program at the school, that confusion around when clubs switch, and some kids kind of not recognizing that they had signed up for more than just the first quarter club. So as we get ready to relaunch Big Friends in February, we'll be kind of making sure we have that communication with the kids and the family so that they know it's not just following the quarterly club rotation of the Mansfield Middle School. And that's all just kind of getting used to things being back in the flow and getting used to kind of programs returning in a more pre-pandemic way than it had been, just because even last year when we had brought programs back, we were interrupted by the Omicron variant. So this is kind of, we're knocking on every piece of wood available to just kind of have a very normal year, as normal as possible, and to keep the big programs up running and moving and going. This year we definitely had a lot more success in keeping our volunteers consistent, which was one of the bigger challenges we faced last year. Was we, in our work with UConn, and in their policies, had a lot stricter protocols in allowing their volunteers off campus. So this year, our volunteers have mostly been able to show up every day. We haven't been, substantially down volunteers, which is where we had kind of found ourselves at the beginning of last year with some of the challenges. So I know I sent out the report and all the numbers of precision are there, but we definitely had a very big crew for COPE this year. COPE coming back was bigger than I think we were expecting, which is great. It's really exciting to be able to connect with, I think the final numbers, 86 first, second, and third graders in one semester. And the wildness of being able to do that while we are, we were essentially a core staff of 2 people and an intern is just amazing. So the volunteer component of that is just what makes everything possible with those programs to be able to reach that many kids. So we're still kind of figuring out exactly with Principal Rodriguez what the second semester will look like. We having to split between the 2 elementary campuses, elected to serve the first graders during the first half of the year and kind of a double dose of COPE, being able to combine their lunch and recess time. So they got the same number of hours of mentoring that they would have if we had been able to do a full year lunch program, but having to split sites. That wasn't something that we were going to be able to continuously do just with the schedules to make sure that when the volunteers were coming out, they had enough time to be with the kids. So the second and third graders will continue with the lunch only version of COPE. So they'll get that full year, and then we'll be working with Principal Rodriguez to kind of figure out how to give the fourth graders the biggest dose of COPE during this half of the year, as they are not only preparing to transition to the one elementary school, but also preparing to transition to the middle school. And we really wanted to make sure those fourth graders during this part of the year had those extra connections and supports, and kind of looking at what it's going to be like to go up to the middle school and seeing what other kind of ways that we can bring back some of those connected programs that we've done before. So the second semester we'll still have the second and third graders, and then we'll be kind of figuring out our recruitment and scheduling with the fourth graders based on the current schedule of the schools, and also kind of working with the folks to know how the schedules might change with the one school and when that might transition, because I know that is still a work in progress. So the mentoring programs were definitely the biggest chunk of what we were able to accomplish this semester. The kids had an amazing time. And, you know, it was great to bring those programs back. It was, you know, I think Danielle Anna Bellini, who ran those programs so well for 5 years, always describes it best when she calls it organized chaos, because it looks that way from far away, but like when you tune into each of those interactions, those kids and those mentors are just like, they're right there with each other. And the connection's so real. We had lots of hugs and lots of sad goodbyes for the end of semester. So, you know, seeing those connections tells us that they're getting exactly what they're supposed to be getting, that connection, that sense of support. And with so many kids this year, we actually ended up, instead of being in individual one-on-one mentoring relationships or a few pairs, we ended up, our mentors did an amazing job basically hosting small groups at tables. So a lot of our mentors had at least 2 kids, if not 3, sometimes 4, as part of that little lunch interaction. And we actually got to see how cool it can be, where the kids are supporting one another, and you can kind of see some shifting behaviors from into more social normed behaviors when they're working together, which was really great to see. So we'll be excited to bring that back. We also have a new community liaison over at UConn who started this year. Her name's Martha. So we were all kind of like, hey, we're all new, everything's new, and we're just making it work the best we can. And I think from the reactions we were seeing from the kids and from the bigs, I think we did a pretty successful job with that. And so we're happy to have Robin joining us and to be handing off of these programs and, you know, helping her get a sense of what they are. She got to see them in action, which is great. And, you know, she'll get to grow them as her own from here, which we're really excited about. Kelly has also been doing a social skills group over at the Goodwin campus. It's kind of like a time limited. I think it was about 7 or 8 weeks for just a small lunch group of kids. And then I had already mentioned Sophia's doing that 5th grade lunch group check-in over at MMS. That's been a smaller recruitment pool this year than in past years. But I think, you know, it's been helpful certainly to have that linkage available for some of our kiddos that will keep up. I think I had mentioned in September that we were not running My Voice right now, just because of the staffing concerns. But now that we are resuming some of our more robust staffing, we can kind of look at how we bring My Voice back and what it can look like, but also recognizing that we came up with a different alternative plan to spend the LPC grant in collaboration with the Mansfield Middle School. And I have a call later on with a vendor for that to take care of that grant spending to help with the vaping prevention initiatives that are required for the LPC grant this year. We have enough robust funding from the enhancement grant this year that even if we're not using LPC funds on the My Voice group, that we can still run a My Voice group or something equivalent to that if there is interest and need, and that it doesn't necessarily need to be focused on vaping if there are other things that the group is interested in producing for public service announcements. My Pride has continued to meet on that 2nd and 4th Thursday this year, just because it lined up a little bit better with the school calendar, and I've been running that one. Robin will get to see it in action in January. And we'll kind of go from there. And then we have also been making sure that the diversion program has continued on, and we've had to like shift the structure a little bit since we don't have a consistent circle runner with Sarah's transition over to the adult side of things. So I've taken over the coordination component of getting folks on the schedule, explaining the expectations, and getting all of the referrals and things that way, and then sending them out to the individual case managers for each town. And each case manager has been taking care of their own circles. So as we're finished filling our positions, we'll see if that continues to be the thing that makes the most sense, or if there's other ways that we're going to kind of rearrange those duties. But we've been able to make sure that youth have been able to be seen for the diversion in those restorative circles. So I think that is where I am done talking a million miles per hour. And like, here's all the updates from months on months of busy, and the excitement of what it will be to have our new staff coalescing as a team, and the opportunities for expansion based on what everybody in our new team brings to the table in those areas of excitement, those areas of skill, and working with our stakeholders here in Mansfield Board of Ed, as well as Region 19 Board of Ed, with that expansion of services to kind of really identify what are the needs and how do we best meet them.
All right, any questions for Katie? Great, Katie, thank you for a very thorough update. We appreciate the dialogue and the work. Next, we have a human service report. Pat?
Hi, so I gave you a little bit in the sense that, again, I'm supposed to be retiring at the end of the month, but we'll still be around a bit for January and February. And hopefully they'll have more success with recruiting my successor in early months. Just a report on the holiday program. We've had a very, very active and busy year. This year we've served so far 49 families with 124 children. And that includes with holiday food and gift cards to local supermarkets so that they can purchase what makes most sense for their families. And gift donations that we were of gift cards and that we were able to purchase gift cards with, as well as the wonderful Stuff a Cruiser program that the troopers ran this year. They were able to stuff a cruiser at plus this year, even with the horrible weather that we had. So families also were able to choose from the toy shop as well that we set up, and that's been great. It still exists. It's in Sarah Dufresne's office right now, so that's been nice for families who have come to us last minute and after our annual giveaway. So very generous community in so many ways, and Sarah's done a great job in her first year at coordinating our holiday programs. And again, thanks to the fire department who opened up their doors and were great partners and allowing us to use the firehouse, and of course, as always, the troopers who are just fabulous and wonderful partners. I know that several of them were there for the toy shop too, which was great as well. So this is a tough year for families for energy assistance. You may be hearing stories not only with the cost and the coolness, but also because of the some of the staffing issues that all human service agencies are having. Access is really having a challenge. The funding's there, but if you don't have staff to do your programs, then you can have all the money in the world if it can't be distributed quickly. So we've been doing what we can to help negotiate, and also working with Wayne, who runs Operation Fuel, who's fantastic. And then again, utilizing some of the town's Neighbor Helping Neighbors funds when we need to step in. Sarah's also been really busy with the RARE program, which assists people who are behind on rents and mortgages and utilities. So that program has been funded through the ARPA funds, and it's being very utilized this year. So just wanted to let you know that social services is busy, certainly senior services is busy. We're going to be starting the budget process, and a great note, the town council did authorize the use of ARPA funds for us to get a van that youth services can use, as well as other parts of the department. We had some challenges this past summer. We had been able to use Parks and Rec vans. They found the transportation cost prohibitive over the summer, and their vans were less available for youth service programs and as a backup for Dial-A-Ride. So we will be purchasing a van that will be able to use cross department, and especially with the additional staff and youth services, it will just be great to have a van that can be prioritized for our summer programming and services. So that's going on. Does anybody have any questions? I mean, I know we talked a little bit about the facility study that's going on, which is kind of, we're talking probably years out, but has some, big ramifications for our whole department and the town hall, but including youth services as well. So I think their suggestion is to put all of human services together, possibly build something somewhere around where the town hall is, so that you could have some synergy from the town hall and the community center as well. So but it would definitely give both the senior center and youth services some dedicated space where they would be prioritized for their programs. So, and it'll just be great to have the whole department together. So that's my report.
All right, thank you, Pat. Any questions for Pat? All right, we'll move to old business. We have our sector reports. Would anyone like to share a sector report?
And just as a refresher, that's that moment where y'all as our resident experts on the call and our community members are sharing with us the concerns that you're seeing that are coming through your offices, coming through your phone lines, coming through your emails from our youth families, schools, stakeholders, and things like that.
Yeah, thank you, Claire. I think mental health support and needs locally are is still a need. Oftentimes we sometimes we hear from families like they're having struggles finding the right fit for outside of school support. So that seems to be an ongoing need for this region. Our school counselors and school psychologists and the social workers certainly help plug in and make connections as we're able to. But that's a theme I'm hearing. Yeah, and
One of the
you
things
talked about youth prevention and how we're collaborating at the middle school. Although we haven't had a lot of vaping cases, which is great. One is too many in my book, particularly at the middle level. So, we're working on doing some help support that initiative. We're going to, we can share in the future what that is once we're established. But we're looking, we want to cut down our cases to zero. So it is the preventative work. It's the collaboration with youth services. It's getting kids support. Oftentimes there's an underlying root cause that has students engaging in risky behavior or any sort of behavior. And so it's helping students and our kids address any root needs or causes to adverse behaviors. So that's kind of been our approach and model. And so hopefully that partnership will continue as we have new staff. We had a few referrals recently, and we'll fill up Robin's schedule pretty quickly, I'm sure.
Larry, I have a question for you, because one of the things I've heard from a couple of families that come in through my office is the big issue is finding someone who will see them in person, that there are lots of slots open for virtual appointments, but less open for in person, as well as challenges getting into places where they can do meds as well. That seems to be what I'm hearing. And I know that there has been a big shift of people who are, practitioners who prefer to do sessions from home, but that doesn't work in every situation. So that seems to be what I'm hearing.
We've heard some of that too, so that doesn't surprise me.
Okay.
I don't think there's a lot of med management availability in this area, so that does pose an issue and a barrier.
And so we know when we're making those referrals out for families who are considering med management as either currently a need or as a future option, those places like United Services, CHR, and Perceptions are all kind of the top of list because they do have in-house med management. Because we know if you're kind of not already connected to a place that has in-house, it's a lot harder to maintain your current provider and then add a new prescriber, because those individual prescribers are definitely fewer and farther between than they ever have been. So those kind of, we call them like the one-stop shops, are definitely our go-to referral sources for when medications are even a question.
Not for nothing, but as a person who's got everybody in my family seeing therapists and med management people, the 14-year-old has been referred to their has been referred from CHR to their physician for potential med management. They are currently with CHR med management, and their therapist is like, so could you switch to your pediatrician? So it's busy, and everybody's 2 to 3 weeks out.
Mhm.
Thank you, Laura. That is good to know that we're seeing those places start to try to triage some of their med management out to prescribers. I know the Access Mental Health Line is designed to be a tool to help physicians with that, but it's certainly interesting to hear that we're seeing that push at that level. So thank you.
I've heard all of the same things that you all have talked about just now with families, with addition to Pat, you talked about the energy assistant and really kind of that need. So I've been making lots of referrals over to you guys for that, because there's lots of families that are struggling right now. On top of everything else that you all have said, there has been a bunch of families looking for LGBTQ like education support and looking kind of for that support group, but also education, really feeling like they're struggling where they want to support their child, but they're not entirely sure how to do so. And they're not really comfortable like reaching out to like the school social worker or having that conversation with them. And the last one is families with all the families that I'm talking about right now have 15 to 17-year-olds that are using, they're vaping, smoking, alcohol, and families are kind of looking for some support around that, but again, hesitant to go to the school and talk with them. They're more looking like, you know, from the frame of, from what they've said to me, like prevention's great, but it hasn't worked. They're already using. Like, what do we do now? How do we help them now? And that being in that age of 15 to 17 is a rocky age with a lot of different things as far as like treatment, and you can't force them and all of those things and the laws that kind of surround that. So they're looking at, you know, having conversations about harm reduction and is that ethical, you know, for their 16-year-old who's, you know, using substances, is that ethical, you know, and moral for them, I guess. So having those harder conversations with families, trying to get them to the resources that they need, or give them at least the information so that they can make their decisions. But they're struggling. I'm looking for support and education across the board.
Laura?
I learned that PFLAG Hartford is in Manchester and is starting a group in stores. So that would be great I'm going to be going as a parent of non-binary youth. And I am sort of an active member of Al-Anon, and Alateen is a tremendous resource. But just Al-Anon for the parents works for drug use too.
Okay.
Vaping and drug use. It works for any of there are people of all sorts in the Al-Anon circles. And there are meetings around, not actually in Mansfield.
Perfect, thank you. And I'm good to know about the PFLAG for stores, because for the time being, I've given families, there's a group kind of in the northeast part, further northeast than Mansfield, that does have a virtual support group for parents right now, because that's the preference of the group, is to be virtual until they decide they want to shift forward to in person. But for the time being, that's kind of where I've sent them and given them the other resources you talked about as well, Laura. But I appreciate to know about PFLAG in stores, that I will keep my eyes open for that.
And there's also a Central Connecticut and Eastern Connecticut trans closet thing where they've got a storage of binders that people can go and trade as you shift sizes. But I've lost the information.
I have that info, and there is, just for anybody's reference, there is an agency that is not in Connecticut but does offer free binders to transfer for youth. And if you need that info, I can get it. It doesn't matter if you're not in that state, they will still send it to you as the youth need it. So
I could use that information if you could send it to me.
absolutely, I can do that.
And I did put the PFLAG chapter info in the chat. They just officially chartered last month. They had their first meeting. I think it was November 20th or so. And so they're going to be a Tallinn Mansfield PFLAG chapter that we're really excited to have in their meeting at one of the congregations that is open and affirming here in Mansfield when they're holding their Mansfield meetings. It's one of the churches that joined us for Celebrate Pride this year. So we're really excited to see that growing in community and to kind of have Mansfield be in a nice, really central part of kind of rainbow welcome in this part of the state that's been fewer and farther between, especially since the PFLAG Hampton chapter has kind of dissolved. And I also know, if anybody's interested, that they are looking for board members. If you are looking to add something to your already very full plates, but if you are interested in becoming a board member, I can give you Lisa Day Lewis's contact information. She's one of the parents who has helped to kind of spearhead bringing this chapter into this part of the state. So she is actively recruiting, and I'm happy to help make those connections.
So I just wanted to reference back towards the comment about the parents looking for what to do for their 14 to 17-year-olds with drug use. I think that implementing the DARE program into the middle school is really going to help with that. And also as a resource, I can reach out to the DARE coordinator and see if we can put together a presentation that's specifically for parents, that helps parents understand what the signs are, what to see. Same thing with, we have a really good one that we do for social media. There's a lot of surprising information, facts and statistics that are out there that the parents don't even, it blows their mind, honestly. It's very interactive, it's fun. And we could relay some information and some talking points and stuff as well with the parents. So I can look into that with the coordinator and see if it's something that we can do.
And one of the things that we did write into our local prevention council grant is hosting another event with the Hidden in Plain Sight training that we had done virtually at peak pandemic, but being able to bring that back into an in-person kind of walk through bedroom, find out the ways that your students are hiding things that you wouldn't know, and they can easily get on, Amazon or Five Below, and kind of being able to do that early recognition. But I know finding treatment itself is a challenge. So I can kind of start to see if I can tap some more resources. Lisa, hearing that you're hearing a lot more concerns about wanting to get kids into treatment specific to substance use. I know in our area, Perceptions does have a lot of resourcing available to that. I know their Mansfield office is actually an outgrowth of some of their more substance focused treatment centers in the Willimantic area. So I think Perceptions program is generally probably a good bet to start with. But I think we had a change in the way the ARCA program was running at CHR, and I think it's been rebranded in some different ways, and I'm not sure of all of that, but I can kind of see if that is something that has access, or if it's another one of those things where we recognize there's a lot of prohibitive wait lists that are happening in our service providers, particularly in the more intensive services. I know we run into it a lot with the in-home services, things like ICAPS, FFT, MST. In our area, we are seeing that the wait lists are, honestly, we're being told, indefinite, just because there are not teams that are staffed to do those services. And that is actually something that we did share at our Connecticut Youth Services Association Eastern Chapter legislative breakfast that we had yesterday. So we did have local legislators join us on a Zoom call from the Eastern Chapter of CYSA, so kind of our quiet corner. And we did relay that those wait lists, particularly for the intensive services for in-home and PHP IOP levels of care, are creating a lot of roadblocks for getting our kids the access to the things that they need, because they can come to us and we can say we know the right services and we can refer them. But we're kind of really finding ourselves having to be in a stopgap position to connect them to a service that really is the appropriate service that we're not equipped to do, 2 to 3 home-based sessions a week with these kids. YSBs across the state don't have that capacity. And so that's kind of one of the biggest challenges, particularly in those more intensive levels of care. So I am thankful for our legislators for coming to hear that from us yesterday. And with the new legislative session, we'll kind of see how that shifts and changes with anything they can do to support kind of that systems network block.
All right, any other sector reports? All right, we'll move up. Go ahead, Deborah.
Just quickly, I just, in keeping with the staff shortage thing, we've got funding for a school psychologist and have been unable to fill that position thus far. And that is really quite hamstringing, as you all know. And the only thing I'd point out on a positive note, I think most everybody has heard it, is that the high school achieved a Blue Ribbon Status Award, National Blue, and there will be a townwide invite celebration sometime in the spring, but that's an important milestone. I think only 3 were given out in Connecticut this year. And our superintendent, principal, and one of the teachers did go to DC to receive that award. And it was based on some pretty very specific criteria that the high school had to demonstrate in order to qualify. Doesn't mean there aren't lots of things to do up there. We're working heavily on a thorough examination of equity issues at the high school. And there'll be a lot more to come on that, but that just a brief update of what's going on up there. Looking for a school psychologist.
Thank you. All right, we'll move to new business. So for new business, we have the 2023 meeting dates proposal that was on the agenda. So I would say if you have access to the agenda, it might be easier to take a peek, but I can list off and share. So there was planned no meeting in January. Proposal for February 14th, March 14th, April 11th, or as an alternate to push to April 18th, because April 11th is potentially a Mansfield day off once they approve the calendar. May 9th, June 13th, September 12th, October 17th, which would be pushed to the 3rd week in observance of Indigenous Peoples Day on October 10th and a potential professional development day on November 14th and December 12th. So would we like to have some discussion around those dates?
So Larry, I would just point out that the April date is for this coming year, so it is already the approved
Oh, yeah,
one. So
okay. I'm thinking, yeah, thank you.
So it's all of the second Tuesdays except for October, which we've consistently done on the 3rd Tuesday, because we kind of know the patterns. But that April one, up to the group if we want to push it to the 3rd Tuesday to accommodate the April vacation, or if the group wants to cancel it, or if they want to still have it the 2nd Tuesday.
I might advocate for shifting it to the following week. I think we've done that in the past. So I would advocate for that.
Me as well.
Yeah. So are we allowed to, we should be voting on this today.
Yep, we vote on this today, so you can propose the vote with the April 18th date for April. And then we'll vote, and then I will get all of the memos to the town clerk's office, and then we will be very good FOIA compliant, public meeting noticed advisory board.
Yep, so we would seek a proposal to approve the suggested calendar or meeting dates with the shift to April 18th. That's what we're going to be looking for.
So moved.
Okay,
Yeah, totally
Second.
in support.
seconded.
I'll second it.
Thank you. All in favor?
Aye.
Aye.
Opposed? Okay. Abstentions? All right, so it looks like we have those dates established for next calendar year, 2023. All right, so that's it. We've concluded our meeting for today, so I'll take a proposal to close.
Yeah, and I'll just put on the record officially, we had no public comment.
Oh, yeah. Yep, public comment. Yep.
I actually I had a question
Yeah.
that I probably could have asked prior. It's been brought up to our office, the situation for the juvenile review board, what the circumstances entail for a secondary offense. How specific is that? Because when it comes to, let's say THC, we have one offense is listed as using. The next is just having it in possession. The next it, right? So what if somebody's already gone to the review board for, let's say, a THC complaint, and now they're getting accused of assault or something else? Are they still entitled to the review board, or not necessarily for assault, but where's the line on that? Katie, I see that you're excited to talk. Go ahead.
Oh, it's changing. So in past legislation, one would accept a second referral on a case-by-case basis. And second referrals, and particularly third referrals, would kind of automatically kind of go through the court system. THC is its own little weird bubble in terms of the youth laws, where those are getting kicked around a lot. But starting in January, and this is what is getting rolled out to ISBs in this month, in meeting with probation and meeting with our partners of the juvenile justice liaisons, to talk about what is going to start happening at probation. So the courts are going to start using a risk-based system to do a lot more community diversion than they have previously. They've kind of already started doing this on a case-by-case, judgment basis, where if court receives a referral that they think is a better fit for diversion, they'll kind of contact the boards and say, hey, will you take this? But starting in January, it is going to be, this does not fit our risk-based criteria. We are sending it to diversion. JRBs are not really going to have the option. Well, we'll have the option to say we can take it or we can't take it based on capacity, but we're going to start receiving a lot more referrals that are going to be screened to community diversion. What we are hearing is that the courts are really looking to capture the most high-risk kids that are going to be kind of the more violent offenses, the larger offenses. So a lot of the smaller infractions are going to just get automatically screened out to diversion. And once the court has screened out the offense to diversion, even if we as the JRB say, this individual is, not wanting to participate or has not successfully completed diversion, the courts will not then retake that case because it's already been screened out to diversion. So we may end up with a lot more referrals coming through to us, either being screened out by diversion. Although I will say that, EO and the resident state trooper's office in particular have been really good about sending us cases that are appropriate to be seen, and been really collaborative and kind of building that process as we go, and the learning curve of that as we go, which has been really helpful. But we're going to start seeing a lot more community referrals, I think, across the state. We'll see what that means for our kind of 3 regional towns. And yeah, we're going to stop having kind of that cap of second and third offense, because it's going to really end up being kind of up to the courts, what's going to get sent down to us. So if there's ever a question, it is okay to send it to court, or like if there's ever a question, contact me as the coordinator, and I can kind of put my feelers out to it. But for the higher risk offenses, those are the ones that are more likely to be screened in to the court and probation process, and the less severe cases are just going to be sent to community.
Okay, so I do have a meeting with the court system and probation because of the changes taking place in January. So I'll be doing that next week. I had to reschedule. But in the meantime, should we just send to the review board? Okay, that's what I'm thinking too, even though it's a second offense. Okay, so in the meantime, because our troopers are just looking for the right information on what the process is and how we can filter it out. So I need to just put together a structure and use some of the samples that we have as well, so that we know,
Yeah.
because like I said, we have the same offender, but it's two completely different areas. What now?
Yeah, and I would say if there's like a question on a case, y'all are welcome to give me a call, and I can kind of either know like, oh yeah, that's going to get screened to us, like don't even bother. Or if I'm not sure, I might say, let me, contact either Erica Bromley or Jason Moriarty in, our JJPOC office or in the probation office that we're connected to, and kind of get a sense from them. And if we're on the fence, we can send it, particularly knowing that we're going to be finding out a little bit more about what those risk-based screeners are. I think my meeting with them is scheduled for next Monday. So I'll kind of hear the official rollout, even though I've heard the unofficial rollout, and we'll kind of see how that shifts and changes. But we'll keep going, because that's what we're going to be doing as a state. And it's ultimately going to keep a lot of kids out of a problematic system. And that's going to be great. And it will be a big adjustment period for diversion programs and youth service bureaus. So we'll kind of keep working alongside everyone else who's working in good faith to make it the best system it can be.
Can I ask a clarifying question? So if the court kicks down a case to you and the family refuses to participate, their case essentially stops right there.
Yeah, so if a court screens it out as a low risk case and says we're referring you to diversion, and the family or youth opts not to participate, there's not really an impetus for them to be compelled to participate. And those cases are the ones that I think they are anticipating are going to be the cases that show back up in a referral system in court, and that they will eventually meet that risk level. And the hope is just that, as they rise up to meet that level of risk, that the damage done on the way for everybody involved is as small as possible. But I know that that's a hard spot to be in, with kind of this gap in this crack that folks can crawl through. And the reality is the hope is, as we describe what diversion is, that there's parent interest in it, because it's not just to, support the youth. It's not to punish the youth. It's not to punish the family. It's to help support the family and kind of figuring out how they want to identify goals to make their experience of being a parent to this child an easier experience for everyone, and kind of getting that parent buy-in and kind of being able to invite them into that space, rather than have them say thanks, but no thanks, we're good.
Okay, so there is a reporting back that there was a refusal. So there's an inventory of that being collected.
I think we'll kind of hear a little bit more what they're looking for from the YSBs versus the probation side of things, and what the communication mechanism is for that. I know we'll keep our own internal records of how that goes, and we'll see kind of what the expectation is for that cross communication, and what we're allowed to cross communicate or not, because it gets a little sticky with diversion.
Okay. Any other questions? All right, I would I'll take a motion to conclude.
I'll move to adjourn.
And second.
I second.
All right. All right. Thank you, everybody. I hope everyone has a good one, and we'll see you around.
Thank you all. We'll see you in February, but not Larry, because thank you, Larry.
Poppin'. Thank you, everyone.
We'll still hunt you down in your office all the time. It's fine.
That's it.
All right.
All right, bye now.
Take care, everyone.